Guys, in your country, in India, for Egyptians in Egypt, okay? For Indian in India. But step 2, it is only in UK, in Manchester. Guys, are you focused? Are you, guys, this boy is naughty, yeah? He's quite, you know? So what is step 2? What's your name? Huh? Yeah, so what's step 2? Step 2, where do we do it? Do we do it in Hyderabad or Kerala or Chennai? You choose one of these 3 cities. Chennai? Kerala? So we only do it in UK. Step 2, UKMLA only done in UK. Okay? You will get the visa through the test. When you book the test, you actually get a visa called visitor for the reason of the test. Okay. What is this UKMLA step 2? What is this exam? Guys, write down, it's hands-on. Write down. Hands-on clinical OSCEs. So, step 1, UKMLA, it's on the computer, it's questions. Yeah? Or written paper questions. Step 2 is only done in UK and it's an OSCE exam. What is the meaning of OSCE exam? What is the meaning of OSCE? Guys, what is the meaning of OSCE? What does that mean? It's just you and the patient. But the patient is not a real patient. He's a simulator. He's what? So they bring a simulator, you and the simulator. Clear? Guys, clear? You and the simulator. Okay, which one is more difficult? Step 1 or step 2? You can step 1 or 2. Which one is more difficult? Step 2. Why? Because step 2, there is an examiner sitting there, and you and the patient, and he's watching every move. He's looking at you as a doctor and in the consultation. So, step 2, how's the exam? How many OSCEs? How many OSCEs in step 2? Guys, 16 OSCE. Write down. It's 16 OSCEs. Guys, are you there? How many OSCEs? 16. You and the patient. But the patient is a simulator. Okay? So, how many minutes do you leave for every OSCE? We have 16 cubicles, and every cubicle has a simulator who is simulating a certain condition. So you talk to him as if you are talking to a patient. Let's say he's simulating. He's actually having a script of a condition that he's coming to simulate for. He's easier than a patient because he's coming to simulate a certain condition. He's not like a patient will get you lost. Okay? He's coming to simulate a condition as a patient. Now, we said 16 OSCEs. How long for every OSCE? So you and the patient, you and that simulator, how long do you have? How many minutes in every OSCE? Guys, 8 minutes. The OSCE is how long? 8 minutes OSCE. Okay. In front of the door outside, at the door, you have write down 1.5 minutes to read the question. So outside you have 1.5 minutes to read the question, and then you enter the cubicle and you have how long? 8 minutes inside. So, what do they assess you on each OSCE? What is the assessment like? Guys, so, how many minutes at the door to read the question? 1.5 minutes. How many minutes inside? 8 minutes. So 1.5 minutes outside and 8 minutes in the cubicle. Now, what do they assess you on? Write down, guys. 3 domains. Write down, please. Write down, please. 3 domains they assess you on. They assess you on 3 domains in every OSCE. Number 1, history taking. How good you are in taking history and asking for differentials. Number 2, management skill. Are you good in managing or not? So history taking, management, and the third point they assess you on is Write down, this is very important, communication skills. So, let's break it down quickly. Step 2 is what? Is it written? Is it on the computer? Is what? Step 2 is what? Hands-on. Whom are you dealing with in the cubicle? A patient who is a simulator. How many OSCEs? 16 OSCEs. Every OSCE at the door, how long do you have? 1.5 minutes to prepare yourself. You enter the cubicle, you have how many minutes? 8 minutes. What are they assessing you on? 3 domains. History taking, management skill, that you reach your diagnosis and manage, and communication skills. Okay. There is something very important here to tell you guys. In this OSCE, PLAB 2 or UKMLA Step 2, listen, communication skills, if you are not good in communication skills, you will never ever pass the exam. I need you to highlight it. I need a star next to this. So please circle communication skills. Circle. So, listen carefully. Each OSCE is how many domains we assess you on? 3 domains.